Good morning, my dear brothers.
Good morning, Father.
Welcome to our class, Biomedical Ethics. In our last class, we had seen few clips with regard to puberty, human reproductive system, conception, fertilization, etc. Those were the clips that were relevant to our topic, that is the new reproductive technologies. And today we shall learn something about artificial fertilization, also artificial insemination. Okay? Now, what is artificial fertilization? Fertilization naturally takes place or occurs when male sperm, that is called another word for sperm, that we learned, male gametic cells, okay, male gametic cells are introduced into a woman's body through an act of sexual union, and one of the sperm succeeds in what you call penetrating the woman's ovum, that is called the female gametic cell, and fertilizing it. Artificial fertilization is brought about when a male sperm are not united with the female ovum through an act of a sexual relationship, so called coition, but by some other means, when the what you call the relationship doesn't take place, or the result doesn't come out after the relationship, the conjugal act, the marriage life, they go for artificial fertilization. In artificial insemination, male sperm are introduced into the female reproductive tract by the use of a cannula, or so-called a thin tube that I will show you in the video, that is inserted into vein or human body. In this case, this thin tube is inserted in the uterus of the woman. Or other instruments with fertilization taking place when one of the sperms so introduced fuses with the woman's ovum. Fertilization takes place within the woman's body, not outside, okay? It takes place within the woman's body. In vitro fertilization, male sperm and female ova are placed in a petri dish, that we will learn in IVF. In the coming classes, we will learn about in vitro fertilization, but now just introducing the word in vitro fertilization, where male sperm and female ova are placed in a petri dish, outside the human body, in the lab. Hence, the name in vitro means a glass piece, where the sperm and ova are placed, and they are, done the research in a piece of glass in the research lab. And subsequent fusion of sperm and ovum and fertilization takes place outside the woman's body, that is IVF. We will come to know in coming classes. Now, both these forms of artificial fertilization can be either homologous, or heterologous. Homologous artificial fertilization uses the gametic cells of a married couple, whereas the heterologous artificial fertilization uses the gametic cells of individuals, not properly. They don't have to be even married, to each other. Although one or both of the parties may be married to another person. We will learn now. Now, artificial insemination. Let us see a small clip.
Hi, this is Dr. Rashmi Yogesh, consultant in fertility, Nova EV Fertility, Kormangla. Artificial insemination or intrauterine insemination is one in which the processed semen sample of the husband is injected into the uterus of the woman at the time of ovulation or egg release. And this is a very simple and an effective method of trying for pregnancy. When a couple tries naturally to achieve pregnancy, there is about 10% chance of pregnancy every month, even if the couple tries exactly during the ovulation period. Intrauterine insemination adds to this by making sure a pool of sperms that are normal and motile are placed inside the uterus quite close to the egg, because the egg is inside the fallopian tube after it has come out from the ovary, and the sperms are placed as close to the fundus or the topmost part of the uterus. So that reduces the time and also the attrition that happens at the mouth of the uterus, and so a proper concentration of sperms would be able to reach the uterus, and so the chances of pregnancy would be quite better as compared to a natural intercourse. They say that the chances of pregnancy would be between 14 to 15% per cycle when a couple tries to have pregnancy with intrauterine insemination, apart from trying naturally also.
Homologous artificial insemination or artificial insemination by husband. No, I have put it what you call short form AIH, artificial insemination of the husband. No, that is called what you call homologous. No, taking from one's own husband. Heterologous, that is from the donor. No, not proper husband. It could be when he could be married or even unmarried, not necessarily be married. Okay, homologous from the same husband, heterologous from the donor. We learned about organ donation. Donor, the third person. We don't know who is he. We don't know who he is, but we are taking the what you call the sperm from the what you call the third person, known or unknown. We don't know whether he is married or unmarried, but he is a donor. Okay. Now, homologous artificial insemination or artificial insemination by husband, that is AIH, introduces the husband's sperm into wife's body by use of a cannula. I said is what you call thin tube that is being inserted in what you call a woman's uterus, okay, or other instruments. Ordinarily, the husband's sperms are obtained through masturbation, although an alternative is the sexual relationship using what you call condom or other means, or even surgical removal of sperm, where the sperms are being stored. Some married couples, they opt for to AIH, artificial insemination of the husband, in order to achieve the pregnancy when, for whatever reason, the husband is not able to ejaculate within the natural relationship. In that case, they take, using the masturbation or what you call using the surgery, they take the sperms and they insert into woman's uterus. Okay. It is also used when the husband suffers from, when there is a low count. There is a term that is put there, oligospermia. That is when his husband's sperm's production is very low, and thus makes the conception likely less. Okay. In this case, through natural relationship, they will not be able to achieve the pregnancy. In that case, they have to take it out and do the research. And they may have to strengthen it, the sperms, and they have to make sure the count, they have to make sure the count, and they are strong enough, or if they are infected, in the case when the natural pregnancy through the natural relationship is not taking place, due to some defects in the man's body or woman's body, they have to do the research, they have to take it out and do study, then they have to do it artificially. Okay. Artificial insemination can benefit couples or individuals with a range of needs. In the United States of America, 6% of women aged between 15 to 44 years are unable to conceive or maintain a pregnancy after 1 year of relationship because they have their own bodily issues and defects and problems. So in that case, they go for artificial insemination. They take the sperms of the husband, they insert it into his own wife. There are successful stories. Even in spite, there are also unsuccessful stories. Now, how it is done? What is the process? Conceiving requires a man's sperm to travel up to the vagina through the cervix, into the uterus, and into a fallopian tube where an egg is being fertilized. However, sometimes a man's sperm is not mobile enough, speed enough to make this trip in the woman's body. Other times, a woman's cervix may not be favorable to allow the sperm to travel into her uterus. In these instances and other situations, artificial insemination may help a woman to conceive, may help her to get a pregnancy. Okay, you get me? That is called artificial. That it is not done naturally. They take the man's sperm and they insert it, using the tube. Artificial insemination is a fertility treatment method used to deliver sperm directly to the cervix or the uterus, in the hopes of getting pregnancy. Sometimes these sperms are washed or prepared to increase the likelihood of a woman who will get the pregnant. As I said, they take the sperms outside the body and they study it. If they are weak, they may with the medicine, with the chemical, they may strengthen it. Those weak sperms, they may be strengthened by the chemical medicine, and once they are observed and seen that they are capable of producing, capable of what you call giving life, then they insert it in woman's uterus. Okay. Two chief approaches now we have, that is with regard to artificial insemination. That is, one is intrauterine insemination, IUI. I have put it here. IUI. The other one is intracervical insemination. Some women may also take medications to stimulate ovarian follicle growth and increase the conception chances. Now, let us see what is IUI, that is intrauterine insemination. Insemination is ready to begin after the preparation. During the procedure, the fertility doctor implants the sperm directly into the uterus with a fine catheter, keeping the vagina walls open using a speculum. The catheter, the word catheter here, this is what you call medical equipment, would mean a flexible tube inserted through a narrow opening into a human's body. Particularly, it could be bladder, or it could be in veins, and it could be in the woman's uterus. That is called what you call a catheter. I shall show you in the picture. For the best results, IUI normally occurs or takes place very soon after the ovulation in woman's body. The ovaries have only just produced eggs. At fertility is at its highest during this point in the what you call a so-called menstrual cycle. Mostly, the women ovulate approximately 2 weeks after the first day of their cycle. Now, let us see what you call the video, which explains about intrauterine insemination.
When couple comes to our chamber, they usually ask, doctor, what options I have? Basically, there are 3 types of treatment. One is when we give them some tablets or injection to grow eggs and they can try naturally. Another most important way is when we give them medicines to grow eggs and we can do IUI for them. IUI is one of the most popular treatment which is well accepted by doctors and by the patients. So what is IUI? If we see the full form, it is intrauterine insemination. That means we are taking the husband's semen, we are processing it. Processing means we are cleaning it, and after processing, we select the best moving sperm and take 0.3 to 0.4 ml of it and put inside the lady's uterus. So it is the intrauterine insemination of husband's semen. That is known as IUI. It is one of the simplest treatment, and if your tests are normal, if at least your one of the tube is patent, if your husband's semen parameters are normal, the couple can undergo IUI treatment. Usually, how do we do IUI treatment? The lady is called on second or third day of her periods. We do a scan. If scan is normal, we start them on oral medicines, and to some patients we even put them on injections and call them for the follow-up serial scans. Once the follicle is ready, like 18 to 20 mm, we give a egg rupturing injection, and after 36 to 40 hours, we call them for intrauterine insemination. So on that day, we instruct them that first husband will come and give the semen sample. The semen will be processed in the lab, which takes almost 1.5 hours for processing. Once the sample is ready, the lady is asked to lie down on the couch, and from down below, through a very simple method like a hair-like catheter, we put the husband's semen inside her uterus. The process of putting semen inside the uterus will hardly take 2 to 3 minutes. It's painless procedure. It is as simple as doing an internal checkup, and after 15 minutes of doing IUI, the lady can go back home, or if she's a working lady, she can even go to her office. Post IUI, usually there is no rest, no special precautions are required. Sometimes we prescribe a vaginal tablet to support the pregnancy. So intrauterine insemination is one of the easiest procedure. It gives a good pregnancy rate up to 18 to 20% in the couple where other parameters are normal. That means the tube should be open, at least one tube should be open, and husband semen parameters are either adequate or to some extent they are near normal. So this is the treatment where the couple can be benefited.
As the doctor says, there are many couples, they are not able to achieve or obtain their pregnancy with their what you call natural way of what you call relationship, so-called in the conjugal act, in the marriage life. So and therefore they go for this artificial insemination. Artificial insemination. There are many successful stories. Also, there are many unsuccessful stories. People keep on doing it 2, 3, 4 times, but it's expensive. Depends on the hospital, depends on the city. This what you call procedure is a bit expensive. Sometimes it is a bit painful, and sometimes it can also infect your what you call genital organs that are there in your body. There are stories. They get pregnancy. Also, there are stories. They come disappointed because it doesn't permit or doesn't work out, or they have some defects in their body. The body doesn't allow them to get their pregnancy. Many families, many couples, they go for adoption, because they are not successful, what you call in attaining the pregnancy, either through the natural method or through the means of artificial. Okay. Now there is another definition for the artificial insemination. This seems to be a bit simple. Artificial insemination, that is AI, is the procedure in which previously collected semen, already you have collected the semen or sperm, what you call your sperm preparation is introduced into a woman's vagina, cervix or uterus. If the sperm is from the woman's husband, the procedure is known as homologous. As I said, it is a homologous artificial insemination or artificial insemination by husband, AIH. Okay? But if the sperm is from what you call from a male donor who is not married to the woman, she is not my husband. He is not my husband, but he is a third party. We don't know. He is unknown to me. He is unknown or known to me, but it is referred as a heterologous artificial insemination or artificial insemination by the donor. No, there are many people, no, when they have some what you call a problem, issues with no, their husband's body, they go to the center, IVF center, and they collect the sperms of unknown people, and no, and they use it and they get what you call no, pregnancy. There are also good many stories, no, morally connected, no, when people misuse no medicine and this IVF practices, no, then they threaten, they say what you call the sperm that which you collected from the bank, IVF bank or IVF center is mine. No, the child may resemble mine, no, resemble my face. Then he may threaten the woman for a bribe or even no other what you call other means where she has to undergo a lot of sufferings, and even sometimes the woman is committing suicide. No, there are good many movies, no, because husband is not able to what you call come in natural way and what you call help her to get the pregnancy. So she goes and collects the sperm from the bank, no, from the IVF center, and she gets pregnant. Once she gets pregnant, there is a man, phone call, no, unknown number comes and says, no, the sperm that you collected from the bank is mine. The child may resemble, no, face may be like me, and what you call it. Then you have problem with your husband. Sometimes the wife might have done without the knowledge of the husband. No, there are good many cases and good many what you call movies, which gives more information and more no insight or more what you call learning with regard to artificial insemination.
IUI is intrauterine insemination, and it's a procedure by which sperm is inserted into the uterus to allow the sperm to get closer to the egg to increase the chances of conception. IUI is a very easy procedure to perform. It's performed in the office. Patients don't require any medication or anesthesia. It's very similar to having an annual exam with a pap smear. The first step is placement of a speculum so that the provider can see the cervix or visualize the cervix. This is one of the actual catheters that we use for the IUI procedure. It's very tiny and it's soft and flexible. And the sperm sample is drawn up into the catheter. It's a very small volume, and then it's gently inserted into the uterus, and the sperm is placed at the top of the uterus, close to the openings of the tubes. And then the catheter is removed. It only takes a few minutes, and it's a pretty comfortable and easy procedure. The risks of IUI are very, very minimal. Occasionally, patients will have very mild cramping or a tiny bit of spotting after the procedure, but complications such as infection are very rare, less than 1%. IUI can be used in different situations. It may be recommended for different diagnoses or different clinical situations or conditions, but it's most commonly used in younger patients who have open or patent fallopian tubes, in cases of unexplained infertility, and in cases of mild male factor infertility. But it can be used for other indications as well. For example, sometimes patients are taking a medication to boost their ovulation induction medications, and some of those patients will also pair that medication with IUI. Insurance coverage really varies. Some providers cover the procedure a limited number of times, while others provide more coverage. So it really depends upon the patient's insurance carrier. It's very important for patients to contact their own insurance carriers to obtain specifics related to their own plan. We have specialists at the center that can give patients more accurate information about their specific plan. We have several financial service representatives that would be happy to obtain that information for our patients.